Hello everyone. Welcome to my channel Random Knowledge Official. I hope you are having a wonderful day. Before moving forward, please do subscribe my channel and press the bell icon. Today we will see about the second wave of COVID-19. When the coronavirus pandemic began early in 2020, experts wondered if there would be waves of cases, a pattern seen in other virus pandemics. The overall pattern so far has been one of increasing cases of COVID-19, with a surge in the summer and a larger one in the fall. Some locations that saw a high number of coronavirus infections early on, followed by a decline, are having a second wave of increased cases. In this video we are going to discuss below topics. 1. What causes a spike in coronavirus cases? 2. COVID-19 second wave in India may peak by mid-April. 3. First versus second wave. 4. What is different this time? 5. Will things get worse? 6. How long could this second wave last? 7. Preparing for a spike or second wave of coronavirus in your area. Topic 1. What causes a spike in coronavirus cases? Human behavior is the major factor. State and local governments, as well as individual people, differ in their response to the pandemic. Some follow COVID-19 precautions, such as physical distancing, hand washing and mask wearing. Others are not as prescriptive in requiring these measures or in restricting certain high-risk activities. In some cities, towns and communities, public places are closed or practicing limitations, such as how many people are allowed inside at one time. Others are operating normally. Some government and community leaders encourage or even mandate mask wearing and physical distancing in public areas. Others say it is a matter of personal choice. However, the relationship between those precautions and cases of COVID-19 is clear. In areas where fewer people are wearing masks and more are gathering indoors to eat, drink, observe religious practices, celebrate and socialize, even with family, cases are on the rise. Also, places where people live or work closely together, like multi-generational households, long-term care facilities, prisons and some types of businesses, have also tended to see more spread of the coronavirus. Coronavirus outbreaks at nursing homes and superspreader events. Gatherings of people where one infected person or more transmits the virus to many others continue to occur. Topic 2. COVID-19 second wave in India may peak by mid-April. Scientists have predicted using a mathematical model that the ongoing second wave of COVID-19 pandemic across the country could peak by mid-April, following which the infections may see a steep decline by the end of May. During the first wave of COVID-19 infections across India, the mathematical approach, named Sutara, predicted that the initial surge of infections in August would peak by September and lower in February 2021. Scientists, including Manindra Agrawal from Indian Institute of Technology, IIT, Kanpur, applied the model to predict the trajectory of the current surge in infections and found that the number of daily new infections is likely to peak in mid-April for this ongoing pandemic wave. Topic 3. First versus second wave. The recent spurt in COVID infections is more rapid than the previous wave in September to October last year. During the first wave, it took 32 days for the cases to rise from 18,000 to 50,000. However, the cases have risen at nearly double the pace in the second wave. It took a mere 17 days for the cases to rise from 18,377 on March 11 to 50,518 on March 27 this year. Topic 4. What is different this time? The spread of the cases, unlike during the first phase, is restricted only to a selected number of states. According to the Ministry of Health, 84% of the new cases are restricted to only 8 states and 5 states account for 80% of the total cases. In fact, Maharashtra alone has heavily dominated the ongoing surge in the country, with the state accounting for roughly 60% of the daily new infections on an average. Moreover, unlike the previous wave when vaccine candidates were still in various stages of development, India now has two vaccines, Covishield and Covaxin. Even though the country is far away from achieving herd immunity, the ongoing vaccination drive is likely to make a difference in the fight against the pandemic. The Union Health Ministry said that most of the deaths related to coronavirus were occurring among the people aged above 45. With India opening up its inoculation drive to include all those above 45 from April 1, the country will be able to protect its most vulnerable groups against the virus. So far, the country has administered over 60 million doses and fully vaccinated nearly 8.87 million people, nearly 0.65% of the total population. Topic 5. Will things get worse? The number of cases is likely to rise further in the wake of relaxed restrictions, the festive season and assembly elections in 4 states and 1 union territory. India saw its daily infections peak once it gradually began relaxing restrictions following a strict lockdown. This time around, most of the economy has already opened up and restrictions are largely relaxed. In fact, some states like Maharashtra and Punjab have started reimposing curbs to control the situation. However, in the absence of a strict lockdown, the virus is likely to spread at a greater pace than last year. Moreover, the discovery of new strains of the virus, which are reportedly more transmissible, have also raised concerns. However, the government has not officially confirmed whether the current surge can be directly linked to the new strains. Topic 6. How long could this second wave last? Several states are seeing exponential growth in cases. In some states, like Maharashtra, Gujarat, and Punjab, cases have already surged to close to or above their previous peaks. Others such as Andhra Pradesh, Bihar, Uttar Pradesh and West Bengal seem to be at an earlier stage in their surges. But if cases continue to rise at current speeds and surpass previous peaks, then the country as a whole will see a national peak considerably higher than the first one. The hope is that vaccinations will play a part in controlling the wave. But the current pace of vaccination, more than 60 million doses administered in a little over 2 months in a country with a population of over 1.3 billion. Topic 7. Preparing for a spike or second wave of coronavirus in your area. Doctors, clinics and hospitals recognize that more COVID-19 surges are likely to occur. They are working with manufacturers to stock up on equipment, and they are continuing their policies for protecting patients and staff members. Here's what you can do now. 1. Continue to practice COVID-19 precautions, such as physical distancing, hand washing and mask wearing. 2. Stay in touch with local health authorities, who can provide information if COVID-19 cases begin to increase in your city or town. 3. Make sure your household maintains 2 weeks' worth of food, prescription medicines and supplies. 4. Work with your doctor to ensure that everyone in your household, especially children, is up to date on vaccines, including this year's flu shot. I hope you enjoyed this video. Please like this video, share, you comment and don't forget to subscribe my channel Random Knowledge Official.